Hello, my name is Ragnhild Dybdahl and I'm an Associate Professor of Psychology at Oslo Metropolitan University and University of Bergen. I'm going to speak about global mental health in sustainable development and why mental health is not only a clinical issue, but an integral part of the sustainable development agenda. First, I'm going to briefly explain what I mean by mental health and the concept of the treatment gap. Then I'm going to outline some of the challenges. And finally, I'll discuss some of the possible solutions and what has been found to work. Mental health is a human right, but it's also at the core of human resources or human capital, which again is key to sustainable development. In the Sustainable Development Goals, mental health and substance abuse are explicitly stated as priorities in goal number 3, the health goal. What do we mean by mental health? Mental health is an integral part of health overall, and you cannot have any health without physical and mental health. However, it's possible to define mental health as a state of well-being where individuals realize their potential, can cope with challenges in life, work productively, and contribute to their community. Meaning that these are the sort of characteristics and the skills that we need, capacities that we need to foster resilience and to reach the Sustainable Development Goals. The treatment gap is an important concept in global mental health and refers to that difference between the mental health needs that people have and the care and support they actually receive. Most people with mental health problems do not actually receive adequate care. In low and middle income countries, the treatment gap is around 90%. Only 1% of health workers work in mental health. So why is mental health a challenge? It's a challenge because mental health problems affect so many people and because the consequences are severe, both in terms of human and economic issues. Mental health conditions cause 1 in 5 years lived with disability. 600 million people suffer from depression and anxiety. Mental health conditions cause early death. People with severe mental disorders have 10 to 20 years lower life expectancy than the general population, mainly due to physical health conditions for which they receive poorer care than other people. Every 40 seconds, someone commits suicide, and each year there will be around 800,000 suicides, which is a leading cause of death among young people. And in some countries, like in India, in Nepal, suicide is a leading cause of death among women between the age of 20 and 45. In low and middle income countries, about 15% of pregnant women and 20% of women who have just given birth experience mental disorders, primarily depression, which may also harm the children's growth and development. New mothers may be suffering so severely that they may even commit suicide. Mental health problems also affect children. 10 to 20% of children and adolescents experience mental disorders. In fact, youth and adolescence is a particularly important period when it comes to mental health. Neuropsychiatric conditions are the leading cause of disability in young people, and this will also have serious consequences for education. Poverty, violence, and extreme stress, such as displacement, disaster, and war, pose particular risk. In conflicts, 1 person in 5 is living with some form of mental disorder. Mental health conditions cause poverty for families, but also pose enormous global problems and costs in terms of economy. Depression and anxiety alone cost the global economy $1 trillion per year, and it's projected that the cost will rise to $6 trillion annually by 2030. Under 1% of health budgets in low and middle income countries are spent on mental health, and obtaining finances for services is very difficult. Another issue which is also very important relates to human rights. People with mental health problems are subject to discrimination and stigma. Human rights violations include torture, incarceration of people with mental health. And as you can see in this picture taken from a newspaper, can also involve being chained. If we now turn to some solutions, I have two pieces of good news. The first one is that investments pay off. They require funding. They require more funding than we have at the moment, but investments pay off. Most mental health services are actually low cost with a high rate of return. Depression services, for example, return over $5 per $1 invested. The second piece of good news is that we know quite a lot about what works. And I will discuss three solutions, or possible solutions here. The first one relates to evidence-based approaches and programs that are based on research that's been done over the years, both different types of research and experiences that have been gathered. Services should be at different levels, meaning that they should be from basic services for everyone, such as safety, to clinical care and specialized treatment. Developing innovative, low-cost solutions has been a priority. Effective interventions can be delivered by well-trained, non-specialist health providers. There is good evidence on a number of scalable programs. A recent example is a great study by Dybdahl and his colleagues that you can see here. They did a cluster randomized controlled trial of a guided self-help program that reduced distress among South Sudanese female refugees in Uganda. Another scalable program with solid evidence is called the Mental Health Gap Program, through which general health workers are trained to recognize and provide first-line support for common mental disorders. There's also good evidence for effective emergency response, including programs like MHGAP. Working principles in those conditions include providing one treatment for multiple problems and focus on skills for self-help. Secondly, mental health should be included in primary health care, and it is an essential part of universal health coverage. So successfully incorporating mental health is core to principle of a universal health coverage, as is equity, quality, and financing. And third, experiences in childhood and adolescence shape our mental health for life. Evidence on how to make care and environments in these years nurturing must be put into practice. Finally, I'd like to mention that emergencies such as the pandemic we are experiencing at the moment can also provide opportunities to build sustainable mental health systems for all people. They can provide opportunity for uncovering human rights violations and to build back systems that are better than the ones that were there before. Mental ill health threatens development, whether that of individuals, communities, or societies. The solution will rely on actors from different areas. There will be mental health, general health, research, policymakers, development partners, users, and civil society that need to come together as a global partnership. Thank you.